own, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and today I would like to welcome to the show Dr. Michael Cohn, who is an orthopedic hand surgeon at Baptist Health, and that is baptisthealth.net/ortho. You can also reach out to make an appointment at 561-955-6784. And we are lucky enough to have him in Boca, and also he is in Boynton Beach as well. Welcome to the show.
Thank you very much, Louise. It's my pleasure.
We're excited to have you, and excited to learn a little bit more about what you do. I know your niche is in ultrasound guided surgery of the hand and upper extremities. How long have you been doing what you do?
So, I've been in practice for 13 years. I was born and raised in South Florida, and did my orthopedic surgery residency and fellowship at the NYU Hospital for Joint Diseases, and I've been back ever since. I've been with Baptist Health nearly 2 years now. I was formerly in private practice in the area.
Okay.
And so I've been in practice, I guess, about 13 years now.
Yeah. So there's a lot of changes in Baptist Health, a lot of great things going on. What's great about being where you are now at Baptist Health with the Orthopedic Surgery Center?
So our hospital, our main hospital, Boca Raton Regional, is going under major renovations, major expansion now. It's really going to benefit our community, our patient population here. And we have wonderful physicians in every specialty. I think it's really a great time for medicine in Boca Raton. Baptist Health really has expanded and is doing a fantastic job.
Yeah, and as the demographic and the population is just growing so much here, we need more doctors like you. So thank you for doing such a great job. Tell us a little bit more about what are the types of things people come in for. I know maybe carpal tunnel. Tell us a little bit about that, and maybe what other ailments that people would see you for.
Definitely. So I'd say two of the most common hand problems that people come in for to see someone like me would be carpal tunnel syndrome, which we're going to chat about, and a condition called trigger finger too. That's one where patients, sometimes from overactivities, the tendons in the fingers will get inflamed. The tunnel will clamp down on the tendons, causing pain at the base of the finger and sometimes locking or catching of the finger.
I think I've seen
very,
people
very
with
common.
that. Yeah, I think
sure
I've
you
seen
have.
that. Yeah. So is that due to repetitive motion, like the carpal tunnel and the trigger finger? Is that like?
It can be. They have very similar kind of risk factors. They tend to run together. People that get trigger fingers oftentimes will get carpal tunnel syndrome because those tendons that we're talking about that get inflamed, they travel with the median nerve, that carpal tunnel nerve, and if they're swollen, they can act to pinch the nerve. So a lot of times patients will have both conditions.
Wow.
But there's a lot of similar risk factors, overuse, repetitive gripping activities. There's medical conditions that can play a role, like diabetes, for example, or rheumatoid arthritis.
Okay, I was going to ask you if there were going to be other factors involved. So people who have those ailments makes them at a higher risk to have these types of conditions.
Definitely.
Interesting. So what are ways that for people to not get carpal tunnel?
That's a great question. There's no way to 100% prevent carpal tunnel syndrome. However, like a lot of conditions, you can reduce your risk. One risk factor is our weight, maintaining a healthy weight. We know that obesity plays a role as a risk factor in some folks. So that's one way to reduce your risk. And at your workstation, you want to maintain good ergonomics, meaning you want your wrists to be sitting at a neutral or straight position, more or less. We don't want to be sitting with our hands flexed or extended through the wrist for prolonged periods. That puts increased pressure on the carpal tunnel nerve, we call the median nerve. And you want to take frequent breaks when you can, when you're doing your work activities. You want to try to minimize the repetitive motions as much as we can. Some things we can modify, and some things we can't.
Sure.
But I think those are some of the great ways that you can minimize your risk.
I've seen some people who wear the hand. I don't know what they're like.
Like a wrist splint,
like a
maybe?
wrist, yeah, like typing with that. Does something like that help ease the pain or help prevent some of the feelings of that, maybe numbness or whatever pain they have?
They can. That's the primary non-operative treatment for carpal tunnel syndrome, is using a brace, primarily to maintain the wrist in a straight position.
Okay.
To decrease that pressure that we have on the median nerve at the carpal tunnel. A lot of times we'll have patients use these braces at nighttime when we're sleeping. We're not sure what we're doing with our hands, right?
Sure.
So a lot of times people can sleep with their wrists folded over, and that may be one of those types of activities that can start the whole process. And then a lot of times, aside from having nighttime symptoms, as the disease progresses, patients often will have symptoms more and more during the day too.
Wow. So, so if somebody goes in right away, they're thinking, "Oh my God, I have to get surgery." What would it look like? What would a person's journey look like, maybe before you do the surgery? Like if I go in and I say I'm having this pain, what would it look like? Would you do X-rays? What's the process like?
Yeah, very good question. So, an initial consultation in the office, typically, we'll have a chat about one's symptoms. Are they having numbness or tingling? When do they have it? Is it intermittent? Is it constant? So we'll talk about some of the basics of what they're feeling. After that, we'll do a physical examination to confirm what's going on. A lot of times we can get a good idea in a condition like carpal tunnel syndrome what's going on just from talking.
Sure.
But the next step is confirming it with a physical examination and some special testing. Personally now, I use ultrasound examination in the office as part of my standard consultation for somebody that comes in with possible carpal tunnel syndrome, complaining of numbness or tingling. And right on the spot after the physical exam, we'll do a painless ultrasound exam. It's very rapid, and we know right away whether that patient has carpal tunnel syndrome or not. And what we do with the ultrasound exam is we're measuring the degree of swelling of the nerve, because when nerves are being pinched, such as in carpal tunnel syndrome, they will swell just before that area of pinch.
I see.
And from research studies in my field, we know at a certain size or a certain area of the nerve, that degree of swelling is going to be a validated diagnosis of carpal tunnel syndrome that I can confirm right on the spot, rather than having to send to a neurologist necessarily for an electrodiagnostic study, also known as an EMG. So, that's one way ultrasound is a really profound benefit to patients now. We can give point of care diagnosis very rapidly, very efficiently. And then, based on a person's symptoms, I like to stratify them, and I tell them this when usually when we do our consultation after the ultrasound exam. There's mild, there's moderate, and severe disease. Somebody with mild disease typically is going to have very intermittent symptoms. A lot of times they'll be just at nighttime
Okay.
from the position of sleep, and they may wake up in the middle of the night and their hand burns or tingles.
Oh, wow.
They might shake their hands to make it go away.
Yeah.
So that's more of a mild category, typically not going on so long. Many times it just started within the past few weeks, few months. But the disease can progress untreated into a moderate stage, which would be more you're having day and night symptoms. It's happening much more frequently, not very rarely, much more frequently now. A lot of times patients will complain, it happens when I'm driving, it happens when I read a book,
Right, right.
as well as at nighttime. And then a severe case is when the symptoms are constant.
Oh,
That can be a
Sounds
sign that the
painful.
nerve is being damaged at this point from the chronic pressure on it. They may have constant numbness, typically to the thumb, index finger, middle, middle finger, and part of the ring finger. That's the area that this nerve innervates or gives sensation to. So severe disease, ideally you want to have the nerve decompressed with a surgical procedure before that.
yeah, I was going to ask, at what point does the person, do you decide that it's time to do the surgery?
So if somebody just has been having symptoms for a few weeks, few months, maybe even a year, but I have them in a mild category. It's intermittent. It hasn't been treated.
Right,
We're going to try splinting usually at nighttime primarily,
sure.
and we'll counsel them about healthy behaviors during the day to minimize disease progression. And we'll keep a close eye on them. I might have them splint for 6 weeks, then come back for a repeat assessment and see if this is helping yet or not. If
Right.
it's helping, we'll continue. If it's not, then we may consider other options such as surgery. But surgery, I think it's best for those in a moderate category of severity where it's really day and night.
Sure.
These people, typically we're not going to get a cure with the splints at this stage. The splints are just going to manage the symptoms,
Right.
sometimes moderately well, but the disease can progress from here in time. So I think the patients in a more moderate category, like I explained, I think those are the best to have the nerve released, a carpal tunnel release, which I'm sure we'll talk about soon.
Yes,
Um,
yes.
And then those with severe disease, they should have surgery. They may not get full resolution of their symptoms, but the disease can get worse where the muscles atrophy in the hand, where you start to drop things.
Yeah.
The numbness can get worse and worse. So even in that category, patients typically get better. They might
Okay,
not
good.
get 100% better,
Right.
but about up to a year out, when they're at their
Okay.
best, they're usually a lot better, even with improvement in sensation.
Wow, that's good. Yes, I was going to ask about the carpal tunnel, the release. Can you tell us a little bit more about that procedure that you do?
Definitely. I should give probably a quick historical perspective
Please
too,
do.
because currently I do an ultrasound guided release. However, we haven't had this technology forever. We used to make a large incision across the hand
Okay.
years ago. It's not typically done by most surgeons now. However, the patients got better. We're releasing the tight band that's pinching the
I
nerve.
see.
It used to be done through a big incision through the palm and into the wrist and forearm. The nerve did great in time. However, because we're cutting through all these other tissues, it took a long time to recover sometimes.
Sure.
A big scar. Sometimes the scar had problems as well. And then in the 1980s, endoscopic carpal tunnel release was developed. And it's similar to arthroscopic surgery. We use a camera
Okay.
and usually a specialized device. And this is less invasive, a smaller incision at the wrist, usually about ½ inch to an inch
Oh.
wide, where the
Nice.
camera is inserted, and then under live video, the surgeon sees the band and releases it and then comes out. That was a great advancement.
Yeah, it sounds like it.
Many hand surgeons do it that way now. It's still a great way to do it, but you have to be under anesthesia generally.
Okay.
That's the minor downside. You have to
Right.
be under anesthesia. And for a lot of people, that means extra steps. You might have to see your primary care
Sure.
physician to get a medical clearance for the anesthesia and get preoperative testing.
Sure. Not
So
everybody
there's-
qualifies, right?
Yeah,
for that.
so there can be extra steps, extra
Sure.
costs. And then about 15, 20 years ago, ultrasound guided techniques were developed. As ultrasound technology is vastly improved
Nice.
over the past couple decades, we're able to see very small structures very clearly now and safely and protect them.
We're going to continue. We got a quick commercial break, but I'm enjoying this conversation. We'll continue with that. We'll be right back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in, everybody. We are with Dr. Michael Cohn. You can reach him directly and make an appointment at 561-955-6784. Whether you're in Boca or in Boynton, definitely give him a call. He is an orthopedic hand surgeon. His niche is ultrasound-guided surgery of the hand and upper extremities. So, Dr. Cohn, we were discussing how the ultrasound-guided surgery is so much more advanced, and you were telling us about the benefits of that.
Right. So, yeah. So the next evolution in carpal tunnel release surgery was ultrasound-guided techniques. At first, they were primitive in the instrument that we would use to do the release, and they weren't very popularized. And about 8 years ago, there was a company that developed a very sophisticated device. It's a single-use disposable device. It has a lot of safety features built in.
Nice.
It's much more elegant and sophisticated to use for ultrasound-guided carpal tunnel release, and that's the procedure I do. It's done through about 4 millimeter incision, so a fraction of an inch. And the great improvement is that now I can do the release not only the least invasive way, so the pain is the least, the recovery is the quickest.
Nice.
But the main thing that I think is amazing and very beneficial to our patients is that I can now do this under a local anesthesia.
Wow.
So it's cost effective.
Nice.
You don't have to go through those extra steps for medical clearance. In fact, they don't even get an IV when we do the procedure.
Wow.
We inject lidocaine, a numbing medication, at the site of the surgery at the base of the wrist. And a couple minutes later, we begin the procedure. It's just a very small incision. In fact, we don't even put stitches to close it.
Wow.
We close it with medical glue. It heals in 5 to 7 days typically.
Wow.
And the procedure itself only takes a matter of a few minutes. The patient walks out with a small bandage on the hand. We have a discussion about do's and don'ts over the next few days. Most patients get back to work within 3 to 5 days. Studies have shown that as well.
Nice.
And even, in Boca Raton in South Florida, We have a lot of golfers,
Yes.
tennis
That's what I
players,
was exactly thinking
pickleballers,
of. Right.
and people that like to exercise and be outside.
Yep.
Once the wound is healed, I just tell people, anything you want to do, go for it. Just
Wow.
be sensible.
Sure.
Let pain be your guide. We just don't want to get an infection of any surgical
course.
wound. This wound heals very rapidly, like I mentioned, and usually within a
Wow.
week.
So no physical therapy. It's just once it heals, you just go back.
Typically, we don't need to send patients to therapy for this. We will educate them on
Right.
just getting their mobility back to their wrist and fingers with home exercises, very simple things. But people can get back to not only work within a few days. I even have a number of patients that have gotten back to those activities like golf and tennis
Sure.
about a week later, which
That's
is remarkable.
amazing. That is remarkable. Because prior to this, doing it the other way, what was the downtime for that?
I would hold patients back about 3 to 4 weeks minimum before
Wow.
exercise, golf, tennis.
That's a quantum leap in
Yeah.
recovery
Yeah,
and
so-
in surgery, in minimally invasive surgery.
Definitely.
So we're lucky enough to have that here in South Florida with you, because I don't know if they're doing this in other places.
So it is growing. I'm actually helping teach other hand surgeons around the
Nice.
nation through the company with the product I use.
Nice.
So we're trying to grow it. I really believe in it. I see the benefits in my
Sure.
patients. At presently, only about 1% of carpal tunnel release procedures in the United States are done with this technique. The main reason is we weren't taught this when we were in training
Sure.
because they're newer technologies.
Right.
So they're not popularized yet. Also, most surgeons in my field are not used to using ultrasound. They might not have a high-powered, high-quality ultrasound
Sure.
machine in their office that they know how to use properly to be able to do surgery with. But we're trying to educate surgeons around
That's
the
great.
nation because this is a better way.
Oh, it is. I think a lot of people, their fear would be, well, I'm going to be out of commission and I don't know how long this is going to be, and the pain and the anesthesia and the surgery. So now it's just totally shifted in such a way that it's just, that's what I love about medicine. It's always changing in the technology and it just keeps getting better.
Yeah, patients really, a lot of them get a kick out of the procedure, being awake,
Yeah.
but not having any pain, obviously. We usually play whatever music they want,
Sure.
so they're comfortable. It's just a nice environment for them. And they like the experience. They usually rave about it afterwards to their friends that
Of course.
they had this neat experience. They had, very small surgery that helped cure their symptoms, and they're usually very happy.
Yeah. So at what point during their symptoms, because I know you said, less painful, moderate, and then worse, at what point, like if somebody's maybe not too bad and they're like, I want the surgery, do you recommend that because they want to get out of that discomfort, or do they have to be a certain pain level or a certain...
Well, that's a good question. I mean, it's really a discussion
Sure.
between the patient and I about how this is affecting them, how it's affecting their activities, their quality of life, how long has it been going on. But, if they're really troubled by it,
Sure.
they
They have options.
They have options we can discuss.
Nice. And what is the age range, more or less, of patients coming to see you?
With carpal tunnel syndrome, it's most common in the 40s
Okay.
and above in adults. But occasionally we see younger people with it.
Wow.
But yeah, generally
Okay.
kind of middle age and beyond.
Now, is this something maybe if I say, well, my mother had it, my grandmother had it, is it kind of genetic or hereditary, or is that hard to say?
It's hard to say. I mean, the carpal tunnel,
Okay.
for which the syndrome's named after, is an anatomic tunnel that transmits the nerve and the tendons from our forearm
Right.
to our fingers. So you can have, theoretically, a smaller tunnel
I see.
anatomically that may
see.
predispose you to this, or having arthritis of the wrist
I
will
see.
also make the tunnel a little smaller, because when you have arthritis, you grow a little bit of extra bone.
Okay.
So that can encroach on the space, increase the pressure in the tunnel that can produce the symptoms.
I see.
And then there's some familial medical conditions like rheumatoid arthritis that can be passed down from
I
parent
see.
to child, and
Sure.
that can make you both prone to have this condition as well.
Makes sense. Well, we have like a minute left. I would like to give your number out before we say goodbye. So please call Dr. Michael Cohen at 561-955-6784, and it's baptisthealth.net/ortho. So yeah, any last words you want to? There are people listening right now. Maybe they're thinking I have a relative or a family member
Right.
who's suffering from this. What do you want to tell them?
Right. Well, thanks for having me, number one, Louise.
Absolutely.
If you or a family member think you may have this condition, come see me in Boca Raton or Boynton office. I'd love to meet you and evaluate you, and we can see how we can help you.
Thank you. We appreciate that.
Very good.
Thank you so much. We appreciate you for coming.
My pleasure.
Absolutely.
Thanks for having me.
Absolutely.